is an icon in 21st century medicine who has touched the life of every single American living with a rare disease. As director of the National Institutes of Health, Dr. Francis Collins has demonstrated pioneering leadership to advance research, and he's provided thoughtful guidance on complex moral and ethical issues. His revolutionary contributions to genetic research have led to the successful completion of the Human Genome Project and the mapping and sequencing of all human DNA. Dr. Collins has also helped to identify genes for several rare diseases, including neurofibromatosis, which means so much to Bailey Gribben, one of tonight's Portraits of Courage honorees. So, by establishing the National Center for Advancing Translational Sciences, Dr. Collins found a way to bridge the gap between promising basic research and clinical development. In 2007, he received the Presidential Medal of Freedom. In 2009, he was awarded the National Medal of Science. Please join me in welcoming Dr. Francis Collins, Director of the National Institutes of Health, and Bailey Gribben will present the Lifetime Achievement Award.
Well, what an inspiring evening, and my profound and sincere thanks to NORD for bringing us all here together to focus on this incredibly inspiring and important issue of coming up with answers for those 7,000 rare diseases, only a few hundred of which currently have effective treatments, and we aim to change all that, doggone it. I want to thank Bailey for being out here with me. Bailey, who's affected by neurofibromatosis type 2 and who's been such a wonderful advocate and an ambassador for rare diseases, particularly for the Children's Tumor Foundation. And I had the chance to spend a little time with him last summer at an event of that sort, and he is a remarkable young man. But there's so many wonderful stories here tonight of people who, through no choice of their own, found themselves faced with a challenge and rose to that challenge, undaunted by what other people might have said were the odds, determined to make a difference, and who bit by bit, rung by rung, up a difficult ladder, have been making a difference in this really incredibly important struggle to come up with answers for these thousands of diseases. So my congratulations, not just to the people who've been here on the stage, but to all of you for the way in which you are changing the world day by day, year by year. I am admiring you. You are phenomenal leaders in a way that the world needs to hear more about. So thank you, all of you, for being here. And for me, rare diseases were never about something you read in a textbook. Rare diseases were about people you met in your daily life or in a clinic visit. Cystic fibrosis was for me first a medical problem before it became a research problem. Neurofibromatosis was the most common condition I would see in my adult genetics clinic at the University of Michigan. Huntington's disease, likewise, a challenging, frustrating, difficult problem in the neurological arena. And on from there to other diseases that my lab had the privilege of working on: multiple endocrine neoplasia, ataxia telangiectasia, all these names with lots of syllables, but the people affected with them made an imprint on me and anybody else who came in touch with them that is lifelong. And now in my lab at NIH, which I still manage to oversee thanks to a group of very tolerant and independent-minded postdocs, working on two rare diseases, one being progeria, that most dramatic form of premature aging, which again I met first in the person of an individual named Meg Casey, and later on was inspired by a little boy named Sam Burns. And yeah, anybody who ever met Sam Burns or who watched his TED Talk, you will know what inspiration is all about. So we have this remarkable moment in history in front of us right now, where the scientific opportunities to ask and answer questions about how life works and how disease occurs have never been more promising. Things that I would not have thought possible in my own lifetime are now almost happening on a daily basis, where we have advances that teach us at the most intricate molecular level what's happening inside a cell and what happens when a disease occurs. That's the phenomenal state of science that we see all around us. But the other part of this, the frustrating part, is that here in the United States, we are also at the worst moment in 50 years as far as the support of that science. That an investigator out there in a university somewhere in this great country who wants to work on a rare disease that somebody in this room cares about deeply has only one chance in 6 that their grant application is going to be supportable, which again is the worst it's been in 50 years. And many of those investigators are determined just the same to come up with solutions, and they look for every other source of support, and thank goodness for foundations represented here in this room that try to come alongside and fill that gap that yawns so broadly now for many of these young scientists who got into this area with a dream, a hope, a vision of what they could do and are finding it really hard to get their labs going and to keep them going. So we all need to really work hard on that together. We need to be sure our voices are raised to try to turn around what has been effectively a 12-year slide in the support for biomedical research in the United States through NIH, which is now 23% below where it was in 2003, just at this moment of such remarkable scientific opportunity. We at NIH, and I don't delude myself that I'm here receiving this award as an individual. I know I'm standing here also speaking for those remarkable individuals who lead our 27 institutes and centers. We try to do everything we can to take the dollars that the taxpayers have put in the hands of the Congress, who have then passed them on to us, to make sure that they're spent wisely. But we are frustrated about the inability to do what we could do. We are not limited right now by ideas. We're not limited by talent. We're not limited by the structure of what we do. The National Center for Advancing Translational Sciences, which you heard mentioned, puts us in a position to go after opportunities in rare diseases through their Therapeutics for Rare and Neglected Diseases program that are unprecedented. We're limited by resources. We do everything we can to make partnerships with the private sector, and they are our partners, and this is an ecosystem. And we work with our colleagues at the FDA, and Steve Ostroff, who's here tonight, has been a wonderful new partner in his role as acting commissioner, to be sure that we're doing everything we can to knock down those barriers that might get in the way of therapeutic developments and getting them to patients as quickly as possible. But we need to stand together to try to turn what has been a difficult 12-year period into something that moves this agenda forward in a fashion that truly can take advantage of those opportunities. Just today, before I came here, I was on the Hill, and the Senate of the United States initiated and launched a new caucus. This was formed by a bipartisan effort of Senator Richard Durbin, Senator Lindsey Graham. Those of you who know the Congress would recognize those are two different parties. Those might be two different senators that wouldn't agree about a lot of things, but they agree about medical research. And this afternoon launched a caucus to support NIH and to try to turn around this, what I've mentioned already, has been a really difficult 12-year period. And they're excited about what we could do. They're excited about precision medicine, which has been mentioned, thank you, from a number of people from the podium, to try to find the right therapy for the right person at the right dose at the right time, which is, of course, a critical issue for rare diseases, and one which I personally think has arrived at a remarkable moment where we can bring together the science, particularly coming from areas like genomics, but also the access with patient permission to electronic health records to be able to do research more efficiently, with all kinds of new technologies for imaging, for metabolic measurements, for the ability to use wearable sensors to track what an individual's experience is happening with environmental exposures and with their own body's performance. This is a remarkable moment, but we have to make it happen. And I was grateful to hear the words of those senators this afternoon saying that they were committed to see something really start to change in what has been this difficult gridlock in terms of our national discussion about where we're going to put our resources. Medical research, oddly enough, in the congressional parlance, is called the discretionary budget. Is it discretionary to you? Is it discretionary whether people who are faced with terribly difficult diseases have the support they need in terms of research that might come up with answers? I would think most people would say no. But that's the way in which our current system is currently organized. We can change that. So I want to tell you how grateful I am to be able to stand before you this evening, to be recognized by this remarkable organization, NORD, for which I have such respect. But I also want to say we've got to stand together. We can't put ourselves in a situation where one disease is basically saying we're the only one that matters. We all got to do this together. I often think of this in terms of a musical analogy because I occasionally have been known to participate in music, but I'm not going to do that to you tonight. And that is, imagine how beautiful it is. We just heard some wonderful music now when you hear a wonderful voice being raised in song. But even more wonderful in many of our experiences is when that's not just a single voice. It's a whole chorus. It's a whole orchestra with a chorus. That's what we really ought to be doing right now. We ought to be raising our voices in a symphony that says, this is the time. This is the moment. This is not the time to put this off. This is the chance that we have to come up with answers that are going to change the world, that are going to give life and hope to people who are waiting for that to happen. The science is ready. The talent is ready. This country is ready. Let's not let anything get in the way of that. On my lapel, as just an insignia of that, there's a little pin that I wear. It was something I developed with my wife, Diane, who's a genetic counselor, and with a few other people at NIH during those dark days of the shutdown. In those 16 days where I had to turn away children and adults who came to our NIH Clinical Center because they'd been accepted into clinical trials, and we had to tell them, no, you can't come right now. The government is closed. Our Congress couldn't figure out how to keep us going. That was one of the most heartbreaking 16 days that you can imagine. And we had to do something. So I was like determined, we're going to have an insignia of some sort. I was all for wearing black armbands or something. Some people thought that was a little over the top. So instead, my wife went to the craft shop and the music shop. She acquired guitar picks. She acquired some pens that you could write on guitar picks. And we made this little lapel. And what it says here is basically what the H in NIH stands for. Yes, we are the National Institutes of Health. That's what you know us for. But we're really the National Institutes of Hope. And that's what, thank you. And that's what we're all really here about tonight, isn't it? The opportunity to take all of the moments that have arisen here, the skills, the vision, the science, and take what might have seemed hopeless and turn it into hope for those thousands of diseases that are still waiting for their time. I give you my commitment that I stand with you. I want you to stand with all of us to make the case that we can't wait for that hope to be realized. Thank you, NORD. Thank you, all of you. Thank you to my colleagues at NIH for what you do every day without much in the way of recognition. We are in this together. We can change the world. Thank you.